Welcome to the PA Insights podcast, brought to you by NCCPA. Today, we're thrilled to have Nicole Burwell with us. She's a seasoned PA with over 27 years of clinical practice and a strong advocate for education and equity in the medical field. Today, we'll dive into her inspiring journey from her roots in Washington, D.C., through her impactful work in PA education, as well as her vision for a future of healthcare. So let's get started. All right, very welcome to have on the PA Insights podcast, Nicole Burwell. Nicole, thank you so much for joining us today.
Pleasure, and thank you for having me.
Of course. So let's get started with a little bit about you and your origin story. Any early experiences in life that really sort of shaped the kind of career you wanted to have in medicine?
Absolutely. So I have been, clinically practicing PA. I'm just gonna guess around 27 years or so, but actually a little over 20 of those has been in education or PA education. I am originally from the Washington, D.C. metropolitan area. I am a two-time HBCU grad. I did my undergraduate education at Hampton University and then PA school at George Washington, and then my PhD at Howard University. And I was a National Health Service Corps scholar, so got to work in a rural community when I graduated, which was very impactful and formative in my clinical practice. My area of clinical expertise is internal medicine and occupational health. And I've just had the privilege, I'd like to say, of working in various settings, private practice, federal government agencies, technology companies, and then, of course, PA education. And so most currently, serving in the role of the founding department chair and founding program director for the North Carolina A&T PA program.
Wow, that's incredible. You mentioned several HBCU schools and really wanted to get into a conversation about, the work you've done with HBCU schools and reimagining equity when it comes to PA education. I'm curious, what was it about HBCUs that what did they give you that you maybe didn't fully understand until later on in your career?
Well, I think it's a very unique an opportunity to learn in a environment where you are seeing people that look like you. There is actual, representation and just excellence all around. My family has always been strong supporters of HBCU communities. So, I grew up with the idea that, education is the cornerstone, right? Of course. The cornerstone for your professional development and your personal growth. And my family was very instrumental in demonstrating that sort of collective uplifting of one another by supporting each other to be able to get an education primarily at some of our HBCUs. And then we came out of that with the commitment and inherent understanding that it was our responsibility to then pay that forward and to do that same thing for the generation that is coming behind us. And so that's why I think this role in particular is really a full circle moment for me to be able to, not only be at one of the largest historically Black colleges and institutions in our country, but to be able to be the founder of the PA program.
So, having taught at institutions like Howard, George Washington, Stanford, now leading this program at North Carolina Agricultural and Technical State University, when did you first realize that education was kind of your calling, not just as something you wanted as a career, but something you really wanted to devote your life to?
I think early on. I think actually even in Um, my clinical training as a PA at George Washington University, I was just fortunate to have just phenomenal PA faculty
Mm-hmm.
that not only poured into me in terms of being a clinician, but also being a leader in the profession,
Mm.
uh, especially being in the center of where a lot is going on in Washington, D.C. I think my faculty really demonstrated leadership not only at GW, but within our profession, within many of the four orgs, whether it's PAEA or NCCPA or AAPA, that sort of those leadership qualities were exemplified. And it was something that I wanted to emulate.
So I really want to get your take on what it's like to build a PA program from the ground up, and what specific values are non-negotiables when you sort of start building a program like that. Where do you begin when it comes to starting a PA program from scratch?
That is a great question. It is definitely not for the faint at heart. What I will say is I think whether I didn't realize it at the time, but I think every experience that I have had has prepared me for this moment.
Mm-hmm.
When I say that, I mean like I've worked every position there is within a PA program.
Mm-hmm.
This felt like a very natural step and an opportunity to be a part of a legacy. There are seven now with A&T, seven PA programs that are housed in HBCUs, and I look forward to there being more.
Hmm. So you've also described education as an exponential effort. I'm curious, what walk us through like what that means to you in sort of real world terms.
So when I think about that, we always think about the reward and the impact of our work in the lives of our patients as
Hmm.
clinicians. But as educators, I think that is the return on that is exponential because you are not only having an impact on your student, but also all of the future patients that they will treat.
How do you create a culture where students in these programs aren't just clinically excellent, but also confident advocates and confident leaders, talking about the important impact that they're going to then have on patients coming forward? How do you instill that kind of like culture and mentality so early on in your programs?
I think you have to model it. Um, I've been incredibly blessed to have just a phenomenal inaugural faculty that have agreed to take this journey with me, and I am
Mhm.
thankful every day that I wake up that I have these colleagues to work with. And for a new program, it's not always the case where you're able to attract seasoned talent. One of the unique things about our program is that everybody has the same vision uh, for and understands the why.
Mm,
And I think that's the key. And
yeah.
so we try to model that for our students.
So, what kind of specific clinical rotations do you typically see as like useful for PA students?
Great question. So, of course, we will have all of the core uh, um, clinical clerkships that are required, but also an opportunity for students to do three electives.
Hmm.
There's a commitment within the program that some of these experiences are going to be in health profession shortage areas. where students will have an opportunity to get to know the communities, the needs of the communities, in hopes that they might want to come back and serve these communities when they graduate and are deployed into the workforce.
So I next want to kind of pivot us to talking about topics of equity, disparities, systemic change. How does a lack of representation, how does that directly affect things like patient trust and the outcomes of treatment?
I think, I always want to go back to the data
Of
and
course.
and the literature and what that demonstrates around diversity, diverse teams, diverse experiences, diversity of thought is that our products or our outcomes and our experiences are more rich because of that.
Hmm.
Think that we all lose out, right? When that diversity or inclusiveness is not represented at the table.
So next I want to transition us to a bit of kind of big picture thinking. And first wanted to ask you, what kind of PA workforce do you feel we need 5 to 10 years from now?
Yeah, I think that we as PAs are uniquely positioned to fill a gap in the healthcare shortage that we are anticipating. And I think with some strategic workforce development, it's imperative that we create a workforce that not only reflects and represents the patient population that we serve, but also can meet the changing landscape within healthcare.
Hmm.
And to do that, we're committed to a career of being lifelong learners.
Mm.
The marketplace is not what it was generations ago. Every 4 to 5 years, you have to reskill, uptool, um, to remain, relevant and competitive in the workplace. And now we're seeing PAs that are working not only in education, but at the cross section of being in the clinic and also hospital administrators and leveraging technology. And so that's what I hope to continue to see is PAs kind of leading in all of these spaces.
As an educator, I mean, you've talked a lot about like the technical excellence that PAs need to have now. As an educator, how do you teach students to have both that technical excellence, but also this cultural humility for their patients at the same time?
Yeah, we definitely have to embrace the technology because it's not going anywhere. So we have to
Right.
how to best leverage that in our curriculums, but also not forgetting the importance of healing, touch,
Mm-hmm.
and connection with our patients that sometimes can get lost, in the clinic with a lot of the technology that we have. I think, we also have to continue to remind ourselves to look at our patients holistically, to understand the challenges that they have in terms of accessing care, the importance of that, as well as some of the as well as the other social determinants of health and barriers that they may be facing, and just keeping in the forefront the importance of that human connection.
So let's wrap things up. Let's talk about legacy, paying it forward. When your students graduate and they return to their communities, what do you hope they carry with them from their time in the classroom?
I hope that they carry with them the importance of always being a competent and quality clinician,
Mm-hmm.
but also the importance of leadership and advocacy and giving back to our community.
And what does success look like for you?
Success, I think it would have to be aligned with our mission, and that is deploying these amazing um, um healthcare providers into the community and then wanting to come back and serve uh,
Mm.
in the surrounding North Carolina community, wanting to come back and support the program and wanting to come back and be advocates for the profession.
And if there are any students listening that feel maybe unseen or unsure if there's a space for them in the medical profession, what would you want them to hear from this episode? Do you have any words for them?
Yes. I think, life has taught me the importance that of representation and that it does matter. And I would say, reach out, get a mentor,
Mm,
or get someone that is willing to invest in you, um, to support you, someone who has a maybe shared experience and can understand not only where you're coming from, but where you want to go, and is willing to leverage their time, their influence to help you move forward.
I love that. And last thing I want to ask you, this is a bit of a personal self-reflecting question, but when you look at your career journey, what does paying it forward mean to you? What does it mean to you now?
What does paying it forward mean to me? Um, Paying it forward to me means reaching back and pouring in to not only pre PA students
Mm-hmm.
and helping to provide a pathway to the profession for them, but also investing in current students and faculty,
Mm,
faculty, um, and helping to ensure environments and spaces where everyone feels valued.
I think that's a perfect place for us to wrap things up and end things. Nicole, thank you so much again for joining us for this conversation.
Pleasure. Thank you, Jesse.
That wraps up this episode of the PA Insights podcast. If you enjoyed the episode, please take a moment to rate, review, and subscribe to our podcast wherever you listen.